Case in point, the young girl I had yesterday, they are sexually active. And like Precious said, right? They lack the information. So, through sports, you guys, as you're doing sports, make sure you give out this information. Okay? To start with, what is reproduction? How do you understand reproduction? Someone just speak out, what is reproduction? I've given you a hint here. Anyone? What is reproduction? Now, if you're not a cooperative class, I'll pick. How do you understand reproduction? Please.
Reproduction is a broad concept, but ideally what I understand in it, it involves intimacy,
Okay.
and then it involves menstruation, and related to intimacy and childbirth and everything in between.
Anything in between. About what is there in between? I don't know. Yes, please. Making another human being. Let's clap for both of them. Yeah, so basically reproduction is making another human being. That's reproduction, reproduce. What I was trying to do yesterday, trying to lay strategies for that. It failed, I'll keep talking about it. Man. Anyway, yeah, so a process of making another human being. Basically that is reproduction. However, when you come to the term reproductive health, that's where we bring in everything that you're talking about. Okay? They gave us a definition of what reproductive health is, if you remember very well. And I want someone to remind us what reproduction is. I have a very beautiful picture here, it's just showing a flower. Okay? This is just a flower, right? Yeah, and flowers are good things. How many of us had flowers on Valentine's Day? You guys need to pray. You need to pray. If you don't have flowers, you need to pray. But flowers are good things. So, who can remind us what the definition of reproductive health is? Someone? Now, why I brought in the first slide that I brought was not to make you feel stupid, but it was just to show us that when I bring it usually in the first, it's usually my first slide whenever I'm making a presentation. And basically I want to make participants understand that most times we sit in these rooms and we assume that we are paying attention, but we miss out some few important details, okay? That's why some of us saw only 3 Fs, others saw 4. Others were able to grasp everything by seeing all the 6. So when I ask to remind me about the definition of reproductive health, which we just had a few minutes back, I expect someone to straight away give the answer, apart from the 2. Anyone? I said if you're not a cooperative class, I know what to do. Yes, Eddie.
Reproduction.
No. Reproductive health. Okay, what do you understand by reproductive health? Don't give a definition, but what do you understand by reproductive health?
I think it's acquiring the knowledge concerning what we do.
Okay. What we do?
Yeah.
Yes.
Reproductive health is more mental and social well-being of an individual in terms of relation to their reproductive system.
Okay. Yeah, clap for both of them. Thank you. Mish was attentive, right? So, reproductive health is a term that is having 2 terms in it. We have the reproductive and health. Okay? So WHO, that's the World Health Organization, defines health as that first part of the definition I've provided. The state of complete physical, mental, and social well-being of an individual, and not just absence of disease. Okay? For purposes of reproductive health, we add on that second part. In all matters related to reproductive system, its functions and processes. Okay? So this will bring in the structure, of course, those structure bit of the reproductive system, and also now the functioning. That's why we bring in the issues of like menstruation, issues like pregnancy, and everything. Okay? So that is the definition and the understanding of what reproductive health is. We look beyond just how someone presents. We look at their social well-being. We look at the people that are surrounding them, their peers. What kind of information are they providing with them? What are they learning from the internet? What are they discussing in their spaces? All that is looked at when you're talking about this. So I'm not I hope I'm not being immoral here by projecting this. Yeah? And I hope no one is offended by their religion just because you've seen a vagina here. But this is just basically showing us what our system looks like. Okay? So I've said with the woman, we have the external genitalia and the internal genitalia. On this side is the external. This side, this one, we have the external genitalia, and then this side we have the internal genitalia. Okay? Now I don't know if women know the parts that are there in their organs. Do you know what parts are actually there? Why do you need to know this information in the first place? Why do you need to know these parts? Because they are very, very important when it comes to understanding your reproductive health. How many of us have heard people saying, I have a UTI? Especially women. Women love saying, I have a UTI, I have a UTI. Yeah? You will never find a woman saying, I have STI. It will always be a UTI. But most times it's actually not a UTI. Having an STI, but saying a UTI. So knowing this will help you to know such things, to distinguish them. Or also in case of anything, you're able to know where the problem is. Okay? So in the certain area, I want us to pay more attention to the three holes that we have there. You know what we make up? The start. Which are in the proximity of each other. And you need to take note because they all play a very important role in our reproductive system. So I'll come here. We have this one, the most posterior, or the behind one, which we call the anus. Right? You all know that. And its purpose. Now, God made us when these parts, each of them have a purpose. However, we've tried to turn them into, of course, we've given them more functions than they were given by God. And that also affects our reproductive health in one way or the other. Okay? So this one was meant to excrete the what? The waste from your reproductive system. Okay? Then we have another opening right here. I wish I had like a stick or a pointer. But we have another opening right here, which we love the most of us, men and women, which we call the what? The vagina opening, or the vaginal orifice, which opens to the vagina. Okay? Now this is one of the very, very key openings that are in relation to our reproductive system. Okay? And then we have a third one, which we call the urethra. Now urethra, that's where the urine comes from. When it's coming from the kidneys, the bladder, and then coming out. Now the urethra and the vagina, they are very close to each other. The urethra and the vaginal opening, they are very close to each other. Actually, these other parts, like the clitoris, which is the equivalent of the penis in a man, they're even way above these two. Okay? So this one and this one, they are very close to each other. And sometimes we tend to assume it is one, but they're actually different. I want us to understand that point. Of course, these other things, if you're a woman, you can look at them, you understand them better. Then we have the the internal genitalia. So from the vagina opening here, we open into the vagina. So this opening is opening into, it is this one here, opening into our vagina. Okay? So this one here is the vagina inside here. Of course, the vagina is having a lot of structures in there, glands that make it wet and very enticing, you know. And then the vagina leads to what we call the cervix. So this one here is the cervix. The cervix, that is like what they call the mouth, or the mouth of the uterus. That's the first part of the uterus. Okay? So it is also very important to understand this structure. And then we have now this entire thing you're seeing here is the uterus. Okay? And this is the inner lining of the uterus. This is where the baby sits when you get pregnant. When you're menstruating, it is this inner wall of the uterus that sheds off to give out the blood that you're seeing. Okay? And then this opening here, or this cavity, opens into our tubes, what we call the fallopian tubes. These are the tubes that transport the egg from the ovaries. The ovaries, that's where we keep our eggs are stored. Okay? Yeah, so this is where the ovaries are. So when someone is ovulating, for example, the egg will come from here, it's captured by the tube, it is moved up to a point where it will meet the sperm, they meet and fertilization takes place, and then what is formed comes back into the uterus, in the catheter here, to implant into what we call the endometrium, or that inner layer of the uterus. I hope we now clear with the female system, how it is structured, right? So we also have a male system. Now on a man, I will not talk about all these things, but perhaps in your free time you can look at them. But we have, this picture is showing us both the external and the internal, right? So we have, of course, on the external, what you will see the scrotum, or the stuff carrying the balls, and then you will see the penis, that's on the external, and then of course you will see that opening, or the urethra. What else do you see on the external? I think that is it, right? Leave alone the other things like the anus, which are also there, just like a woman. But then what is inside, that's where we have a number of structures, starting from the breasts, or the testicle. This is where the sperms come from. And then these testicles are picked up by what we call the epididymis, this structure here. They are transferred in this tube. This tube is what we cut when you're doing a vasectomy. They are transferred in this tube called a vas deferens. It comes, and then it mixes up, or it joins the urethra. This urethra is what carries both the sperms and the urine. So they link up from somewhere here. As it's coming from the bladder, it meets this duct that is coming from the testicles. They form the spermatic duct, which comes out from here and as a urethra. Okay? In here also we have different organs. We have the prostate. If you've heard about the prostate gland, this is located somewhere around here near the urinary bladder and the rectum. Rectum is where that last part of the GI of the intestines before they reach the anus. So it's located near the rectum, near the bladder, and near this urethra that carries the urine from the bladder. Okay? In there still we have more glands. We have like the corpus gland, seminal vesicles, among other things. Their work is they produce juices or fluids, and those fluids are what makes up the semen. Okay? So when a man has sex and he ejaculates, what we're seeing is what we call semen. It's not sperms. Okay? It's the semen that contains sperms. Okay? In fact, when a man ejaculates, on average, each mil of semen that we see has over 15 million sperms in it. So a normal ejaculate has over 40 million sperms. Every time a man ejaculates, he releases over 40 million sperms. A normal man. Yeah. So basically that is the structure. I wanted us first to look at that structure before we go into any other thing, so that we understand our system. When a woman is this is like the menstrual cycle. This is now the functioning I was talking about. I'm pretty sure we all know about this, right? Just to briefly refresh our mind, on average, the cycle of a woman goes for 28 days on average. Okay? But we have to understand that we have some women who have longer cycles, maybe 30 days, 32 days, and those who have shorter cycles, maybe like 21 days. And then there are those who have irregular cycles. It keeps changing. This month it is 21, another month it is 30. Okay? But this is on average. So what we are saying here is, if the average woman, the average length of the cycle is 28 days, I would just want you to understand just the different timings in this cycle. Okay? We count the cycle starting from the first day the woman sees her blood. So if you're menstruating, the first day that you menstruate is recorded as the 0, or the 1. Okay? That's when you start counting. And then it goes on until the next time you will see your periods. So that's the entire cycle. Some people tend to confuse this by thinking that the cycle is the number of days they have their periods. No, that's not the cycle. Okay? So you find that most women, they will start bleeding on this day, and then within 3 days, their menses have stopped. Others can go up 5 days. I've seen some go up 7 days. Okay? So, to understand this better, we need to divide this into 2. That is on day 14. So from day 0 to day 14, and then from day 14 to day 28. Okay? Now, day 14 is the middle of the cycle. This is what we call the ovulation day. If someone is having a normal average cycle, that's when they release their egg from the ovaries. Okay? So, after releasing the egg, we have another phase. So, there are 3 phases in this cycle that we need to understand, and that will be the last one about this entire thing of the reproductive system. The 3 phases we have at the first phase. That is the phase from when you start bleeding up to when we enter into what we call the ovulation phase. So that phase is called the follicular phase, as you're seeing up there. Okay? So in that follicular phase, what is happening is you've released an egg, you've ovulated, and now there are hormones that are being produced to make another egg mature or grow. These eggs grow every month. Okay? So you're making another egg grow within that phase, preparing it to be released on day 14. That's why I said with the day 14. So in this entire phase, we are growing that egg for it to reach a point where it can be released from the ovaries. Are you together? And then on day 14, that's when you release an egg. However, this day is not static, it varies. Whereby the release of an egg can occur 4 days before or 4 days after, depending on very many factors that can cause those fluctuations. Environment, stress, and other things. Okay? So, we tend to say that from that 10 up around day 19, that phase, that's what they call the unsafe period. Okay? For some reasons, for like 2 reasons. One is because the egg can be released at any time within that period. But also, the sperms, once released by a man, they will take 5 days maximum when they are surviving inside a woman. Okay? So if you have sex with a woman on day 10 and you release your sperms, it is most likely that by the time she ovulates, the egg will still find the sperms in there. Okay? Yeah, so the first phase is what we call the follicular phase, when the egg is being matured. And then you have the ovulation phase, that is when it is released. And then after releasing the egg, what happens is, what you're seeing here is that inner wall of the uterus. What happens is, it starts being prepared for the baby to be implanted. We are assuming that you're going to conceive, okay? So that inner lining that we looked at starts to thicken, become thick, preparing it for the baby. This inner layer of the uterus starts to become thick, preparing it for implantation, okay? That's why you're seeing on this graph, it is actually increasing in size up towards the end of the cycle. Now, in case you do not conceive, what will happen is the hormone that has been causing that thickening take place, this hormone called progesterone, it will be withdrawn. And after it is withdrawn, you will now bleed again, and the cycle continues. You will see your message, and the cycle continues. So basically, that is the brief about our system. Now, that was out of science. I hope we've grasped it. Like I told you, a man ejaculates around 15 million sperms. So if you're a man and you're having sex 3 times a day, I don't know how many sperms you're releasing with a man. And then after ejaculating, the sperm will survive for 3 to 5 days, like I say. Now, one thing about women is that at birth, by the time a woman is born, they have over 1 to 2 million eggs in their ovaries. But of those, only around 300 eggs will ever mature to be released for fertilization. Okay? So that means most of the eggs that you actually are born with, they do not mature. So around only 300 will actually ever mature at one point. And that's why you see that as the woman reaches the age of 35 and above, the quality of the eggs also start declining somehow, and the quantity, because these eggs are not replaced. They're not like men. Because men, for us, we keep manufacturing, okay? But for women, a woman, we have a specific number, so it keeps declining. That's why when we tell you to give birth sometimes early, what are correct? So our colleagues gave us some of these components of reproductive health, okay? Yeah, so we have a number of them, family planning and mental care, self-delivery. We term all this into self-motherhood, antenatal, postnatal, self-delivery. And then I talked about post-abortion care, HIV, care and support, STIs, cervical cancer. I talked about everything that you're seeing here. Our point of emphasis today is going to be on two. The first one is family planning. Now, I want us to understand what we understand by the term family planning. Ajat, what's your name? Remind me your name? Yes, Shadia. What do you understand by the term family planning?
Several times I think it means giving birth in prepared condition.
In a prepared manner, unorganized manner. Yes, let's go for Shadia. 1, 2, 3. Someone else? What do you understand by family planning? I don't know that for here. Okay, what is spoken? Faustine. As she has mentioned. Okay, you distinguish for us family planning and contraception.
Family planning is one of the methods of how you can plan for your either giving birth, and contraception is, let me say, it's a method of prevention.
Okay.
In simple terms, as I understand it.
As you understand it. Thank you very much for sharing with us your understanding. Anyone else having an idea? What's the difference between family planning and contraception? Anyone else? Yes, please. Ruth.
Family planning is preparation and to have maybe to create a family to have kids. Then contraception is their commodities.
Their commodities. Okay. Yes, Sulaiman, you want to say something?
Yeah, I think, like you said, contraception is the process of preventing a pregnancy. I think it is a subset of family planning. As you're planning for the family, you can choose to use contraception.
Okay. Now, I usually have a problem with the way we use these words, especially when you're addressing young people. We tend to use the word family planning so much, and someone will be like, I don't have a family yet. So why are you talking to me about family planning? Most times they want to hear the word contraception. And the reason is because of what you've just talked about. So family planning is basically a couple deciding on their fertility. They have control over their fertility. So they decide the number of children they want to have, they decide when to have them, and the spacing between those children. That is basically what family planning is all about. And then, on the other hand, contraception is basically preventing pregnancy. So when you're talking to young people, most times we are talking to them about contraception. We are talking to them about preventing pregnancy. When you use the term family planning, you're going to confuse them. And their first question will be, I do not have a family. Yeah, so when it comes to contraception, basically we're looking at the methods you're going to use to avoid getting pregnant. Okay? Now, I want us to have a brainstorming session for like 2 minutes. What are some of them? One, why family planning and contraception? Why should we talk about family planning and contraception? Each one of us is going to give us one answer. Why should we talk about family planning and contraception? Why should we talk about it? When you sit in front, those are some of the
Why do we talk about family planning?
Why are we discussing it even in the first place? Yeah.
So that to be safe, to safeguard ourselves against certain risks, perhaps also as a means of preparation for something, perhaps family.
Thank you. Why should we talk about family planning and contraception? What is it? I'm not about you.
We talk about contraception to prevent unwanted pregnancy. We talk about family planning to let the people get family.
Yes.
In my position, family planning, talking about it now, if I'm to plan, I need to express it or having children that I can manage, take care of.
I think we speak of family planning because we need to understand what brings about the other, the effect of contraception.
Yes, my brother.
say that to prevent.
To prevent, yes.
Because they all know that economics. They are very
The economy is not doing wonderful. Yes, bro. Now, starting from here, what are some of the beliefs you've had in communities about family planning and contraception? Some of the myths. Let me change the word from myths to myths. What are some of the myths you've heard about contraception? Yes.
The second is castration.
Castration. I castrate men every day. Oh. So we have to feel the word and conquer it and eat it. You don't have a name tag, so I can't mention your name, but you can honor it. Yes, Ronald.
Women want condoms because they make them dry.
Does it make them dry? Does it make
They lie.
Let's hear from a woman. Let's hear from a woman. Does condoms make men dry? Me too. Do condoms make men dry?
Like some contraception methods, they are not kind of
I want an experience from experience. That's why I'm tapping on women. Let me come to the seniors.
You see, there are so many things going on in this class. And about time in this session, what is the question? Condoms and dryness?
No, right now, I'm on condoms right now. Yes, condoms. What someone said, the myth is women don't want to use condoms because they make them dry.
No, I don't believe that. I think the issue is in the preparation. Because you don't just have sex. There is got to be
Men, listen.
preparation. Foreplay, let me be blunt.
Yeah.
There's got to be some foreplay and then the fluids will come. If the fluids are not coming, maybe there's something else that's the problem. But I think if you are ready to have sex, you will not be dry. That is a myth.
Thank you.
It's not true. I don't believe it is.
Okay, thank you very much.
And I wanted to comment on that picture.
You comment.
You see, in my village, and many years ago, people said that is a powerful man. Yeah?
That's a powerful man.
That is a powerful
That's not a myth she's mentioning, right?
You see, because he has a big family and he's struggling. Yes, he's struggling to be a good father, a good man. So it just goes on to show how he.
Let me ask you curious. Are you that powerful? I don't know. Shall I my phone? Are you that powerful? Not at all. Let's go back. Some of the myths we've heard about family planning. Someone mentioned about vasectomy is castration, right? We want to inspire that. Someone tell us the actual fact. Is it? Who has had a vasectomy here? Anyone?
I have a story.
Yes.
My brother was married to a very faithful woman and they had 3 kids. Some of the 3 kids said 3 kids is enough for him. He went for the settlement. He got misunderstanding, they divorced. He got another young girl. The younger one's kids can't be their kids anymore. So, vasectomy is castration.
Good for him.
The person who had found that myth. I understand you also you want someone done around vasectomy. What do you usually tell people in there? Tell you that myth. Both. When you're in communities and you hear that, what do you usually tell them?
So, of course, from a point of view that is informed, I tell them that vasectomy, first of all, is not castration. Because with castration, they cut off the balls, the balls of the animal. But for a vasectomy, they only cut the tube doctor told us. So it's not castration. Because with castration, they have to remove the discs. Then for the other technical things, I refer them to the public facility where there is an expert to explain to them the process and the procedure.
The beauty with such procedures, before it is done, you give an information, all the information, and you're told what you're doing is permanent. You remain a very sexually active man, but without seeds. Okay? Someone used to say, juice without seeds. So you will be able to have the same ejaculate, but there are no sperms. So we tell a man and we make sure that he's not making a decision under influence of anything, but it's a rational decision they are making, knowing that I do not want more children. Whether I have another woman or what, she wants to say something.
Is it reversible?
Now vasectomy, the answer to that question is a bit complicated, because the truth is, yes, it can be reversed, but reversal is very, very expensive, not being done in Uganda currently, and there's no guarantee that after reversal you'll be able to regain. However, with the modern technology, we have new technicalities whereby if you want to conceive, to make a woman pregnant, but you had a vasectomy, we can do direct sperm extraction from the testicles and then we place them in the woman for fertilization to take place. Yeah, so modern technology has given us a bit of more alternatives on how we can go about it. Okay? Yes?
But as far as I can fail, right?
Yeah, you can fail. In medicine, we can never say everything is 100% effective. Even when you do that vasectomy, we tell you that there is a chance, 1% chance, that you can make a woman pregnant. It can fail. Yeah, so even reversal is not really guaranteed. Yeah. I know there are many myths. You want to mention something?
Yes. I also hear that in family planning, reduce the fertility rate.
Reduce the fertility rate?
Yes.
Okay. Someone wants to demystify that? Anyone? I thought I have SRHR champions in this room. Anyone wants to demystify that? You, I work with you. Does family planning reduce fertility rate?
It does, but I also heard it as a myth.
As you heard it as a myth. She's a young person that I work with as a young person, not a technical person in family planning. Yes.
I'm sorry, a young person.
As well.
Well, for me, I would say it's a myth, but some extent it could be true. Of course, it will need research and look into it. But when I was at campus, a lot of girls would use the pills, the emergency pills, the birth control pills, or any other method for family planning, and they would, the stories that I would hear, later on if someone wants to have a child, that the fact that you have been using these methods consistently, they could prevent or they could hinder your hand for getting pregnant. It becomes more difficult because the bladder system is accustomed already to
I'm going to have one input and we'll close it off. Time is running out for. Let me first hear from him. Okay, I'll give each one of you 30 seconds. 30 seconds. Yes.
I'll say it's a myth.
It's a myth.
Because when they are manufacturing the contraceptives, they use the very hormones. They use estrogens and progesterone. That is the one that is used to put into a woman. So there is no way it can cause infertility. But those who use those who use contraceptions wrongly, they are the ones that, like, you find someone taking an emergency pill as a long-term method. So that is what causes maybe challenges. In the medical, we say they would delay someone to get pregnant, but not total infertility.
Thank you. Let's clap for him. Now, like you said, and this is happening at campus. At campus, girls stock emergency pills and have them in their suitcases, and they're using them every after 3 days, every after 2 days, like a long-term method. Now you wonder, and you're like, who actually gave these people this information? And that's where the issue of the knowledge gap comes in. Family planning, contraception, delays fertility. There's a temporary suspension of fertility once you're using it. the moment we stop any method you're using, fertility always resumes or returns, okay? And you're able to go on with your normal conceiving. So no one should ever deceive you that once you use family planning, you might not be able to conceive again. That's a lie, okay? However, like you said, we always want to have experts advice because not everyone is fit for every method, first of all. And some methods are supposed to be used in a technical way. You're supposed to be given technical advice. So you come to us, the experts, and we tell you what you're supposed to do. For me, I'm this powerful. I'm not like this one. For me, I'm like Julius. I don't know about Bob and Robert. Ronald, I mean. Yeah. We have these statistics already from my colleagues, but just to read what they said, fertility total fertility rate, we can see. In Uganda right now, every woman is carrying around 5.2. I don't know what the 0.2 stands for, but yeah, I mean as a child. But we get these statistics anyway from we get the total number, we make some dividing and everything, that's we come to that ratio. But that is the total fertility rate. Now, 5 children per woman. The number might look small to you in this room. But this means there's some women who have 1 child, some who have 2, others have 10, 15. In a third world country like Uganda, whereby they're struggling to get salt to use at home. Okay? Teenage pregnancy rate, you've seen it already. Stands at that, they're only 24. By the way, I was emphasizing a point. If you line up 100 people, and 24 of them are people below 19 years of age, it is actually very worrying. I used to work up country, I was working in Apache before I came back to Kampala. And when you go for antenatal in the hospital, you would find a line of young people. I had a woman who came to me and she wanted to abort. I refused because she didn't have any adequate justification. Her reason was, there's no one going to line up with my daughters for antenatal. That was her reason. Okay? She was like, I feel ashamed going to go for antenatal with those young girls. Now, there are some of these things around contraceptive use. Some of them are technical, but what we're trying to say here is around 26%. So if you bring here 26 women or 26 people, 100 people, 26 of them do not have access to a family planning method. Okay? So that speaks to the availability and accessibility that someone was talking about. So I will not waste so much time on that. I want to just talk about this. They are what we call the 40s. Anyone who has heard about them? When they talk about contraception or family planning, they are what we call 40s. And it means having children too early, too soon, too many, and too late. So, when we are talking about family planning, we advise people according to these 40s. You want to make sure that someone does not have children too early. So you want at least someone to be 20 years of age to have their first child. And then after having that first child, not too soon. Give some spacing for you to be able to actually look after this child, for your body to recover, okay? And then don't be like the other man who is powerful in the village. Not too many. And of course not too late. Because we know that most of the complications that come in pregnancy, they also come with those late pregnancies. Okay? Those are some of the methods that are available. I'll not go into details with each of them because each of them has a very big thing to talk about them. But we divide them into basically 2. Okay, we divide them in different ways. The first way is we have what we call the hormonal and the non-hormonal. Okay? So the hormonal ones are those that have the hormones that we were talking about. They work by most times inhibiting ovulation, delaying ovulation, among other mechanisms of action. Then we have the non-hormonal, which work mostly as a barrier method, preventing the sperm from meeting the egg. Okay? And also we can classify them as we have short-term, long-term, and permanent. So the short-term, you use them for a short period of time, a day, a month, 3 months, or maybe a year. And then you have the long-term that you can use for 2 years, 3 years, 5 years, 10 years, 12 years. And then you have the permanent, like the vasectomy and the bilateral tubal ligation. Okay? Then we have what we call the natural methods. For example, when you look at this one, when you talk about long term we have two types. We have the implants, that is what they put here, and the IUD. The IUD is what they insert through your vagina and through your uterus. Okay? They are both highly effective, around 98, 99% effective for both of them. Then the permanent one, like I said, we have two. We have the female sterilization and the vasectomy. They are also highly effective, around 99% effective. None of them is 100% effective. Then we have the short term. Now the rest that you're seeing here, they are all short term methods. Okay? That you're seeing down here. Among them we have the pills, the daily pills that someone can swallow every single day. Then we have the emergency pills, of course, as well. We have the injectables, we have one for 1 month, 3 months. Then we have the condoms, we have the male and female condoms, among others. Some of these, they're not so common in our settings, but they are there. The patch, the ring, the diaphragm, among other things. Then we have the natural, like for example, lactational amenorrhea, that is breastfeeding. So when the pre-tester I saw a question, and I noted it down. So the person who said the pre-test need to revise that question, because breastfeeding can be used as a method of delaying conception. Okay? That is if someone is exclusively breastfeeding. Okay? So you must make sure that the baby is only breastfeeding. So that's why for the first 6 months, if someone is breastfeeding only, most times conception is very rare to take place. Okay? Then there are others like withdrawal, we have calendar, fertility awareness method, that's when things over like safe days come in, among other things. So that is the collection of the different methods that are available. When you come to us, we take you through all this and then explore your needs, explore your any risk factors for any of them, and we choose what is the best for you.
Doctor,
Yes, please.
On lactation and marriage, is breastfeeding still reliable when you receive your periods, even when you're doing it exclusively?
Now, yes. The answer is yes. However, like I said, it should be exclusive breastfeeding. Exclusive, it means the baby is not eating anything. So the baby must be breastfeeding like most of the time. And how it works is because there's a hormone we call prolactin. That's the hormone that is responsible for breast milk letdown. Okay? It causes the breast milk to come down. So once the baby is breastfeeding, that hormone will be in high quantities. Okay? And that hormone now will be able to inhibit fertility. Okay? Inhibit ovulation and conception. However, if you get your periods, this is what we advise. You need now to think about using a backup method. Okay? Because periods is a sign that your fertility is resuming. So we advise people that way. But it can still prevent the pregnancy even when you're having your periods. First of all, I told you already, I don't know, I didn't say this, but ovulation having a period does not necessarily mean you're ovulating. That's why some people who have things like PCOS. You've heard about PCOS? That is polycystic ovarian syndrome. I don't know if you've heard about it. Yeah? There are women who come and they're having very irregular periods and they have added a lot of weight. They're starting to develop some facial hair. Okay? She's taking us off. You don't have it. Yeah. Such women, they're having irregular periods, but most times when we go ahead to check their system and their hormones, we find they're actually not ovulating. Okay? Yeah, so I don't know if I've answered your question. So I will not go through these slides. We talked about each of them. Just rush through. These are the permanent methods. This is how we do a vasectomy. We basically just cut the tubes here and there for a man, and for a woman, we just cut through the tubes here and there. I'll show you those tubes on the other first pictures. Okay. For an IUD, this is how it looks like. We insert it through the vagina, it comes and then it sits on this tube, this T. It's like a T, we call it copper T. So these two arms sit to obstruct the what? The tube, so the sperm cannot meet the egg. For the implant, that's how it looks like. We insert it usually on the arm. Okay? And then for the injectables, basically we just inject depending on the method. There are two types of injectables.
Implant is 99%.
Implant, yeah, it's highly effective. 98 to 99% effective. Yeah.
Somebody is making money.
Yeah?
Somebody wanted to make money.
I don't know what you mean by that. Now you can tell us.
Look at this, that 1%.
My last bit of the presentation is this, and I want to bring it out in a very short way. STIs or STDs, those are sexually transmitted diseases. So that is a disease or infection that is predominantly transmitted through sexual intercourse. I've seen women who come and they have syphilis and they say, I got it from the bathrooms, from the urinals. She's lying. She got it through a sexual intercourse. Syphilis does not transmit through urinals. Okay? Yes. Now, I'll come to something. The sexual intercourse could be through vaginal sex, could be through anal sex, could be through oral sex. And I've mentioned all of them because people are now doing all of them. People first try, they start with the vaginal, and they start with the oral, switch to the vaginal, and they end up with the anal. So you can transmit STIs through each of them. But the risk is higher in the anal sex, and then vaginal, and then oral, in that order. Okay? So, but anal sex is very risky. It has very many effects that are associated with it. And if you've been doing it, please, I don't know. I don't have one for you. These STIs can be transmitted from the baby, from the mother to the baby. That's why when you go for antenatal, on the first visit, the doctor or the midwife will request for some tests, will request for a urine test, syphilis test, hepatitis B, among other things. Okay? The rationale is these things can affect your pregnancy, cause miscarriage and everything, but you can also transmit them to your baby. I've seen babies born with syphilis. I've seen babies born with gonorrhea. Okay? That's why we actually very critical and very strict when it comes to screening during pregnancy. Examples of STIs, we have things like syphilis, gonorrhea, chlamydia. I've put them here. There are very many. Key to note is cervical cancer, hepatitis B, HIV, those three. I wanted to bring them out as key to note. Because cervical cancer, the most common or the major cause of cervical cancer is a virus we call HPV. You've heard about it, the ladies in the house. That's why we encourage HPV vaccination for the young girls who are 9 to 10 years. Okay? Now, even penile cancer, I left it out. Cancer of the penis. It is also transmitted through sex most times by that same virus called HPV, human papilloma virus. So, what happens most times is for us when you meet a girl, I meet Lona, I liked her, she looks beautiful. I ask her out and she says yes. We just run to a pharmacy, grab HIV test. We test for HIV. She's negative, I'm negative. We are good to go. Sweet. But these things are actually transmitted through sex. Hepatitis B is very common. We still encourage vaccination, but it is also transmitted through sex and C. But also, most importantly, HIV. Okay? UTI and the STI, I'll get to that. Why are we concerned about STIs? Every single day, over 1 million STIs, new STIs are acquired worldwide. That means each one of us here is very prone to being among the 1 million people. And this is most common in the developing countries like ours. Okay? In 2020 alone, these were the number of new infections that were registered for these specific STIs. 374 million infections. In that still 2020, 80 million adults have got syphilis. That in just 1 year. One thing to note is there are around 310 and 11,000 deaths of cervical cancer due to HPV that I've talked about. Cervical cancer is actually one of the leading causes of cancer among women. Okay? Even in Uganda. Now in Uganda specifically, each new week we get 1,000 new HIV infections. This is as per 2023. Each new week, 1,000 new HIV infections. And what is really worrying us the most is there is drug resistance that is starting to develop, whereby we give you the drugs, the real drugs you're supposed to take, but they're not working anymore. Because these microorganisms, they have evolved and mutated. They have changed their structure. So these drugs cannot attack them anymore. And still to worry the most, the new drugs in the pipeline are taking longer than we would want them to take to be produced. Okay? That's why we get concerned when it comes to STIs, and that's why we need to talk about them as much. Risk factors, for me I don't know risk factor. I don't think you I don't know if you have others. But mostly it is irresponsible sexual behaviors. And by irresponsible, you know what I mean, right? I'm not going to that. But irresponsible sexual behaviors is the most common cause, or risk factor. UTI means you're having a urinary tract infection. STI, you mean you're having sexually transmitted infection. Yes, you can go to the bathrooms and you contract a UTI or an STI. I was with the doctor, I think 2 weeks back, and he was telling me, we were presenting to an audience like this, and he said to the audience, all UTIs are likely to be STIs. Okay? But not all STIs are UTIs. All UTIs are likely to be STIs. You know why? Because the most common conditions that we see, or infections we see, mostly are STIs. You have a discharge from your vagina. That is not coming from your urethra, it's from your vagina. So it's an STI. Okay? And because of their proximity, I showed you that picture. Okay? So because of that proximity, that infection can easily move from the vagina into the urethra, and you end up with a UTI as well. Okay? But it doesn't necessarily mean that when you're having a UTI, so it is an STI, right? I don't know if I'm making sense, but most times when someone tells me they have a UTI, my first question is, what are the symptoms? And that's what is most important. What are the symptoms? So she will be like, I have itching, I have a discharge, it is smelling in a funny way. However, that is not a UTI, that is a sexually transmitted infection. Okay? Yeah, so some of the symptoms that you find or that you look out for, now this is for your consumption and out there. If you are a woman, or let me start with a woman, and you start experiencing genital itching around your private parts, you start experiencing a discharge, a funny discharge, you start experiencing some growth or some kind of warts, you know, you're seeing some abnormal growth in your private parts. You're starting to get some wounds in your private parts, okay? You're starting to get painful sexual intercourse. When you're having pain, sex, it is very painful, okay? When you're urinating, it is burning. Those are some of the symptoms that you could be having an infection. The best thing is to rush to a facility where you can easily be tested and treated as soon as possible. Let me show you some of these pictures, and these are the last PowerPoint presentations. So syphilis can affect any part of the body. I've had very many clients who come and they just have a rash on the body, not even in the private parts, but on the body. You test them and they have syphilis. So it can affect your back, your face, your mouth, your vagina, any part of the body. And syphilis, the funny bit with it, you can have it when it is silent, what we call a latent phase. You have the syphilis, the infection is there, but it's not giving you any symptoms. Until that time when your immunity goes down, and then it comes out in a full-blown phase. That's why we encourage routine screening. Just get it there. You're not sick. Just walk into a facility and be screened, be checked for some of those things. I talked about congenital syphilis. Like if you are a woman and you have syphilis and it's not managed during pregnancy, your baby is likely to be born when they have syphilis. And they'll have some of those things I've showed you, the rashes, the wounds, they'll have them all over their body. Okay? Yeah, so you need to take care because those things are very serious. Gonorrhea. Now I've shown you two pictures here for a woman and a baby. So this woman, when she was giving birth, she had an infection. One of the common representatives of gonorrhea is you have a very serious discharge. Okay? So if you're a woman and you start experiencing such discharges, please don't, especially if you're pregnant, because this baby was born to a woman who was having gonorrhea, and that gonorrhea now moved into the eyes. Okay? And that's why you're seeing the baby's eyes, they are now producing pus. I think for the mothers who are here, you've seen when babies are being born, we give them some tube on their eyes, partially to prevent some of those things from happening. For a man, what you're seeing here is for a woman. Still, you have this coming from your urethra. I've seen men who come and they're having that pus coming from their penis. It means there's something wrong. Look at this. These are some of the ulcers you can see. You can have these wounds inside your vagina, or even on your penis. You see a man comes to you and these things by the way are very painful. Someone comes and they can't even walk. They're walking like this. Yeah, so some of these things, once you spot some of these things, they are very serious and you need to take care. Okay? You've seen people with warts. Someone gets, this is a penis by the way, but you see how it is eaten up by those warts. Some of these things are caused by the actual viral infections, but they're sexually transmitted. That's a woman with warts, among other things. So it can get as bad as this. That's why we need to spread this gospel, talk to the young people, and emphasize the point of screening. So this is the very last slide. How do we prevent these things? The first thing is, I'll go back to the ABC that we studied in primary. Abstain. Now, I mean, I don't know how many of us can actually abstain. But that is the first. Now, you can the only method that is 100% effective for anything is abstaining. It's 100% effective. If you can abstain, have one person and be satisfied with that one person. Now, my post is laughing. I don't know. Personally, I don't have those issues of moving around because I fear. If you cannot abstain, use condoms. Now, with the condoms, there's what we call correct and consistent use of condoms. Now, what you people do is, you go in when you're very careful, you're very determined, I'm going to use a condom. You start the very first round, you actually have your condom on. And then, eventually, what you said pops up. A woman feels like she's becoming dry. It is just off in one minute, okay? So once you're using condoms, you need to be consistent and use them correctly. For men, make sure that you're circumcised. I don't know why this generation you still have men who are circumcised. Like why? Why would you be walking around with that foreskin? It has more disadvantages than advantages. I've talked about regular checkups, wellness checkups. So make sure whenever you can, you have some money, instead of drinking that beer, come to me, give me that money, and I do some checkups. Yeah, I'll bring that money for you. And then vaccination. I've talked about things like hepatitis B and HPV. Please, if you are a girl and you're here, there's no girl here. If you're a lady and you're here and you're above that age of vaccination, just make sure you do routine screening for some of those things like cervical cancer. Just come and we screen you. Vaccination recommended for people who have not been sexually exposed, mostly. So that's why we look at the age of 9 to 10 years. But if your partner is treatment, please make sure, is sick, make sure they are treated before you engage with them in a sexual activity again. And avoid risky behaviors like binge drinking. You go drink, get wasted, and then end up in a situation where you wouldn't have ended up if you were sober. Let's avoid them. And I've heard these days people are using sex toys. You find two girls, they are roommates, and they use sex toys, so they keep sharing. Please be sure that you sanitize those sex toys. Yeah, so thank you very much. It was a lengthy discussion. Like I said, the topic was broad. I tried to summarize it, by the way. I couldn't go into details for each and every component, but that's what I had to deliver. Thank you. You can reach out to me, those are my contacts, in case of anything.
So, thank you, Dr. Rogers. We are going to give you a rain clap.